Depersonalization is a common mental health disorder frequently misdiagnosed as depression or anxiety. Depression and anxiety are often symptoms of this disorder, but we have to look at the bigger picture. We have to look at what kind of depression or anxiety. We have to look at how they manifest. We have to look at why and how in order to gain a better understanding of how it impacts us. With depersonalization, the brain numbs the individual as a way of protecting them during moments of high stress or anxiety. And when it doesn't relinquish, it can lead to a number of physical health complications such as chronic pain, fatigue, and immune dysfunction, as well as changes in personality and behavior. In educating ourselves about mental health disorders, we have to look at the whole picture. It's important that we don't just look at how they might impact us, but why they impact us in the way that they do. We need to look at the individual experience and take on different perspectives about how we look at the various aspects of ourselves that make up who we are. In this video, I'm going to go over how depersonalization affects our brains and the health complications and behaviors that arise as a result. 3 of our brain's major networks are implicated within depersonalization. These are defined networks with recognized roles and responsibilities that have been replicated across multiple studies, and brain scans of depersonalized individuals consistently show similar patterns of disruption within these networks across those affected. These 3 networks are the default mode network, the salience network, and the task positive or central executive network. The default mode network is very important in constructing our identities. It is you. It's active when you're daydreaming, when you're thinking about yourself or others. Whatever inputs the default mode hubs receive from other regions of our brain may influence changes in identity, personality, and behavior. The task positive network is active when we are focused on something, when something demands our attention. And the salience network is a regulatory network responsible for a lot of our emotional response, emotional processing, responding to salient stimuli like sights, smells, and sounds, and it's also responsible for switching between the default mode network and the task positive network. Depersonalization is the freeze of the fight, flight, and freeze responses, and it reduces activity within emotional brain regions. Due to it, individuals have more difficulty responding appropriately to emotional stimuli. I'll go over the emotional impacts and repercussions momentarily, but brain scans show reduced activity in salient regions, including the insula and limbic structures, and increased activity within hubs of the default mode network. This underactivity of salient regions may explain the lack of emotional inputs individuals receive, being that the default mode network and task positive networks operate inversely. If the default network is overactive and the salience network is underactive, because the salience network is responsible for switching between the two, you will be unable to engage this attentional task positive network. In addition, being that the salience network is also a regulatory network, this underactivity can be why we see a lot of complications with our physical health as well. Obviously, our brains are very complex, but for the sake of helping others understand this disorder, I'm going to break the brain down into 2 separate personalities: our emotional brain and our rational brain. This is a complete brain. The rational brain is represented by the red ribbon, and the emotional brain is represented by the blue ribbon. In the case of depersonalization, the brain protects the individual from whatever event causes the dissociation through an overregulation of emotions and reducing activity in regions of our brain responsible for our pain response. Hubs within the default mode network increase their activity, and individuals maintain their rational personality while being left in a foggy, dreamlike state represented by the cotton balls. Through this process, individuals are often stripped of emotional aspects of their identities, and emotional development can be impeded, as represented by the removal of the blue ribbon. This 3rd example is the external representation of those affected. It is what is seen by others. Obviously, this change is not visible to an outside observer, and all they see is the individual, despite this significant disruption in major brain networks. These changes become the individual's identity, and they will often wonder if they always felt this way, or be unable to remember what these other versions of themselves felt like. Especially as time goes on, it progresses and it becomes their normal. In terms of these 2 personalities, clearly they're going to be different and have different needs. This red ribbon is like your rational survival brain. It's important for problem solving, rational thought, and meeting your physical needs, things of that nature. Its objective isn't emotions, to be happy or sad. It is to solve problems, to keep you alive, to procreate, go to work, to pay your bills, other things that are necessary for survival, not necessarily things that you want to do. This blue ribbon is your emotional ribbon, your reward system. This is your emotions: happiness and sadness, fears, shame, guilt, excitement, and enthusiasm. Your goals, ambitions, desires, wants, and motivation. Your friendships and relationships. It's the ability to connect with other people. Sympathy, who you choose to spend your time with and how you choose to spend that time with them. Patience, compassion, and nurturing ability. Love, this is your hobbies, sports and video games, TV shows and movies. These give our lives meaning. Without this ribbon, it becomes increasingly more difficult to meet your emotional needs, and not just the individual's emotional needs, but the emotional needs of the people around them. These are other very important aspects of our personalities. These are a lot of different perspectives and ways of thinking other than these rational, straightforward thought processes. How we respond to sights, sounds, and smells. These are what make us human. These aspects are our emotional health. It is your ability to support those around you on an emotional level. Over time, as the disorder progresses and the connections to these regions continue to decrease, in the face of emotional stimuli, anything outside of rational support becomes more difficult. As time goes on, emotionally necessary moments may be met with a lack of patience and more frustration. And as it continues to progress, if appropriate, adequate interventions do not take place, frustration and a lack of patience may turn into more violent and aggressive behaviors. And currently, there are no appropriate, adequate treatment methods, other than accurately diagnosing individuals and informing them of the possible behavioral consequences. In addition, it inhibits our emotional processing, which may be the most significant aspect of the disorder. Events that take place while dissociated, especially as the disorder progresses, are not processed and compartmentalized normally. The affected individual is frozen and over time less and less able to react to emotional stimuli and emotionally process life's events. This means friendships, relationships, hobbies, positive experiences, and traumatic or emotionally negative experiences that take place are not experienced, processed, and compartmentalized by the dissociated individual to the same degree that they would be normally. For example, as individuals, what we experience from day to day is a powerful depiction generated by our brains for our benefit. Experiences are fragmented episodes unless they're woven together in a meaningful narrative. This meaningful narrative assists in creating our self, our identities. With dissociative disorders, there is a disruption in the individual's identity. In the case of depersonalization, the overregulation of these emotional brain regions and an inability to be present can result in the individual feeling as if they're dreaming and strip them of their emotional personalities, altering their overall identity. Like I said earlier, it inhibits the individual's emotional processing ability. This can result in the individual's emotional brain being unable to weave these fragmented episodes and experiences into this meaningful narrative. Regardless of who you were before, you are now fragmented, stuck in this over-rational, altered perception of reality. Many do not feel fatigued, depressed, or emotionally impaired at its onset, but it wears you out over time. Like any other disorder, disease, sickness, broken bone, or whatever else, if it is not treated properly, it will worsen. Even if there is no cure for this disorder, the individual should still be able to educate themselves and have an understanding for themselves and their loved ones. The danger in this disruption in emotional processing cannot be emphasized enough. The inability to appropriately respond and react to emotionally negative stimuli is psychologically dangerous. The individual is frozen, and traumatic or emotionally negative events that take place during the dissociation will have to be processed and compartmentalized after the fact, as individuals are less able to appropriately react to it while dissociated, and these changes in personality further. In regards to the ribbons that I covered earlier, over time, this emotional ribbon, personality, what have you, is less and less involved, and it is not experiencing things to the same degree. I'll provide a second example again. In this case, this represents the individual's emotional personality. With depersonalization, that aspect of their overall identity would be removed from what their experience is as an individual, resulting in increasing changes in identity, behavior, and other health problems over time. You are no longer present in what is happening around you to the same degree that you were before. This other part of you is not getting to experience the things that you do to the same degree, like it's stuck behind the glass. It can see what is happening, but over time increasingly lacks the ability to have a say in what those things are. You are unable to be present, and over time it is less a part of the things that happen to you. With its removal, you may not react to something the same way that you once did. I'll cover negativity bias in a minute, but when activity in our insula and limbic regions increases and our pain response reestablishes itself upon recovery, this may result in emotionally reliving and re-experiencing negative events that you are not able to appropriately react to while dissociated. It may also result in the individual reliving the event that caused their dissociation. The longer the individual's dissociative experience lasts, the more overwhelming their recovery process may be. These two ribbons are naturally integrated. If one is removed, in order to reintegrate, the other ribbon must be able to regulate and process whatever events took place before or during the removal of whichever ribbon. Due to this removal of emotional aspects of our identities, it often leads to arrested psychological and emotional development. In other words, being stuck in a particular level of development, and the changes in personality and behavior, as well as other symptoms that present, may depend on the age and developmental period of when a trauma took place. Like I said in the What is Depersonalization video, everything that happens to you from this point forward isn't happening to you anymore. It's happening to a fragmented version of yourself. You are not getting to grow up as a complete person. Everything that happens after this point is happening to a person that is paradoxically both you and not you. You are not present in what is happening around you. This other part of you is not getting to experience the things that you do to the same degree. Like I talked about earlier, this causes underactivity in limbic regions, and if we treat the brain like a muscle, over time when something is inactive, it will begin to atrophy. If we look at the functions of the limbic system and the behavioral impacts that take place from other disorders that impact it, they are fairly uniform. Mood swings and outbursts, trouble with memory, depression, apathy, and uncharacteristic behaviors. Due to the impacts that dissociative disorders have on our brains, they can also cause a lot of physical health problems such as chronic pain, fatigue, and immune dysfunction, as well as changes in personality and behavior. Individuals with dissociative disorders often have difficulty with substance abuse, they may drink more heavily, and may have a higher number of sexual partners. Presentation of dissociative disorders is also very cyclical, as dissociated individuals often struggle with more appropriate parenting and nurturing behaviors. Our brain's insula is a primary hub in the salience network and is an important part in our pain response. In depersonalization, activity within the insula is reduced as a means of lessening the emotionally painful impact of negative experiences. This relates to negativity bias, which is when of equal intensity, things of a more negative nature like unpleasant thoughts, emotions, social interactions, or harmful traumatic events have a greater effect on one's psychological state and processes than ones of a neutral or positive nature. Negative social interactions and negative emotions can have a greater impact on our mental states than positive ones. Due to decreased insula activity and lessened emotional capabilities, over time, individuals may not view these changes in behavior that take place as a result as negative. Regions critical for happiness, sadness, enthusiasm, guilt, shame, etc. aren't getting a say, so when something negative happens, there is less of a reaction, because the affected individual is less capable of feeling negative emotions. Something traumatic may not be viewed as traumatic because our brain has protected us through rational thought processes and objective perspectives at the cost of our emotional experience. As the changes progress, even when those affected realize something is wrong, they may be unable or less able to change their behaviors because of this disruption within their brain networks. The salience network also contains our hypothalamus, which is an important regulatory brain region. It's responsible for very important bodily functions like controlling our hunger, thirst, body temperature, sexual activity and arousal, parenting behavior, shivering, pupil dilation, circadian rhythms, sleep, blood pressure, heart rate, perspiration, and breathing. Due to the underactivity in this region, individuals may have difficulty sweating. They may have difficulty with circulation, trouble sleeping, or getting quality sleep. Even when they are able to sleep, they may still wake up feeling tired or lacking energy. Their circulation may be impaired and they may feel cold. Those impacted by it may have more difficulty climaxing during intercourse, and many may not feel a strong desire to have children as they have more difficulty with these nurturing behaviors. The limbic regions impacted are very important emotional regions of our brain, responsible for frontline, lower-order emotional processing. These regions are also important for processing and compartmentalizing short-term memories and expressing our emotions as well as controlling anger and frustration. Those affected may feel emotionally numb and often have a more monotone voice and are more straightforward. Depersonalization is also the dissociative disorder most associated with aggressive behavior. While a very separate disorder, it is consistent with early symptoms of other disorders associated with limbic atrophy, such as dementias and Wernicke-Korsakoff syndrome. Alzheimer's also impacts our ability to process and regulate behaviors properly, as well as shows higher levels of agitation and aggression as it progresses, as does depersonalization. Because the default mode network is the region activated when we are daydreaming and thinking about ourselves, being that this is constantly active, this may explain the reality questioning, foggy feelings that accompany depersonalization, while still maintaining consciousness. And the underactivity within the salient regions may explain the emotionless, straightforward, and aggressive behaviors. Many more studies need to be done, but the theory is sound. If default mode regions integral in constructing our identities are not receiving inputs from emotional regions of our brain, our identities will be more emotionless as a result. Therefore, to treat depersonalization, you must reduce activity in the default mode network and increase activity in the salience network to engage the attentional task positive network. In addition, clinical improvement in symptoms of depersonalization shows increased insula activity, which is a primary hub of the salience network. For example, if the freeway you take to work or school every day required maintenance and was shut down, you would have to find an alternate route to get to your destination. Your brain works in the same way. When activity in the default mode network is reduced, this allows for other critical brain networks and regions to reestablish their activity. Individuals who are able to recover, depending on the length of time affected and the severity of changes in personality, may have an outpouring of emotions as recovery engages brain regions important for emotional processing. Diagnosing and treating DPDR in a timely manner is of great importance, as individuals will have to emotionally process any events that took place before or during their dissociative experience, including any uncharacteristic changes in behavior or emotionally negative experiences. Time is of the essence, as the longer an individual is affected, the more significant changes in personality may become over time, and the more difficult recovery may be. Regardless, this is an important part of moving forward, as the sooner one recovers from their dissociation, the sooner they can begin moving forward as a complete person again. Hey everyone, thanks for watching that video. You can find more information on the project's website, otbproject.com. All the information discussed in these videos is thoroughly researched and sourced on the site. As always, please make sure to like, comment, and subscribe, as these types of disorders have very negative impacts on the individuals and the people around them, and educating yourself or sharing this information could make all the difference in the world for you or a loved one.